before we get started, about a minute or two. Well, there's the real healthcare expert coming in. You don't have to get quiet yet. I just gave you a warning to kind of get ready to wrap down conversations. So good afternoon, everybody. So thank you so much again for being here. It's been a great day so far, but I've been very much looking forward to this conversation with Dr. Stephen Shaya, who's a doctor, entrepreneur, and investor out of Michigan, and is doing amazing things around the world. So maybe just first, Stephen, if you wouldn't mind, just give everybody a little bit of your story. Let's see.
Hello. Oh, he's going. Can you hear me? Okay. Well, first, I want to thank you, Michael, for this opportunity, and Harry Hawks, who introduced us, and SMU. This is the second time I've been here in a month. I was at the Bush Presidential Library about a month ago, and I love it. Think big, do good. What a great mantra there. I especially want to thank my mother. Every time I leave our corporate headquarters, there's a lot of work to be done. And Mom, I love you, and I hope you get that recorded, please. So thank you. Anyway, just a little bit about my family. We're Iraqi Christians. My father emigrated from Iraq in 1966. He left under political duress. Came to the U.S. with $100 in his pocket. He got 3 jobs the day he landed here. He went to University of Michigan and became a physician. He started a medical lab, which he sold 10 years later. He was retired for about 5 weeks, and my mother basically kicked him out of the house. She's like, you need to go do something. So he started a company called J&B Medical in 1996, and it was named after my brother Julian, who had Hodgkin's disease and was miraculously cured, and also my uncle Bashir, who was he died prematurely, so it was kind of a legacy to them. Today, we have 18 different business enterprises. We run the gamut from medical distribution, where we sell everything that goes in a hospital, pharmacy, physician's office, supply equipment, pharmaceutical, to specialty distribution businesses like EMS, veterinary. Our claim to fame is we're one of the largest third-party billers of consumable medical products to the homes in the United States. We reach 260 million covered lives today via our insurance contracts. We have a telemedicine telehealth company. We do virtual visits around the world. We have a mail-order pharmacy licensed in 48 states today. We're in 48 states. We're in 28 countries today. It is a family business. I get fired quite regularly, but fortunately I have 3 grandchildren from my mother, which is usually a saving grace. I should also mention that I'm a physician. I've done 100 deliveries of babies in my career, albeit I did not deliver our 3 babies for probably very, very good reason. And my mother owns 100% of J&B today, so we say she's boss at home and at work, and she reminded me last night of that fact. So,
Amazing. So I think your title is it's Executive Servant Leader. What does that mean, and how does that manifest itself on a daily basis?
Well, first of all, let me say I was in Kentucky a few years ago, and I said I was with J&B Medical, and everyone got super excited. I said I was with J&B. Everyone got excited. They thought we were the Scotch whiskey, and I was like, I'm so sorry to disappoint you guys. We're not quite that good. But so my family on my mother's side, my grandmother, she had 12 children. While number 12 was in utero, my grandfather passed away. So she raised all 12 children on her own. She was a midwife. She delivered thousands and thousands of babies in a small town in Iraq, a small enclave. And it didn't matter if you're Muslim or Christian or Jewish, or if you had money or you didn't have money. She did it with such joy. She did it with such passion. It is very surreal when people come up to me today and say, "Do you know your grandmother delivered me?" And I don't know how to even I don't even know what to say. It's it's a very special thing. So her love of service, her joy in giving it. And by the way, she never had any money. Okay, imagine raising, I have 3 children and we're sucking wind half the time. Imagine raising 12. But there's such joy in giving and serving humanity. And so as our company continued to evolve and grow, we always wanted to keep that heritage, that DNA of my grandmother and my father, who were both steeped in mission and purpose and service. So at some point, I thought it was best to, live it, and so changed my title to Executive Servant Leader. Still get fired, so that didn't help me there. But I think it's important for people that work with us, people that we affiliate with, people that we partner with. They know that we stand for something much bigger than ourselves, and that it doesn't matter if it's a Shaya family member, that we will help with whatever it takes for us to be successful. And I think that's a very important message, and we do our best to live it every day. Some days are better than others, but it's something I'm grateful that we have that opportunity and the platform.
So talk about, and obviously this platform is remarkable. I mean, when you talk about, you kind of just glossed over 260 million lives in the United States, so that's 2/3 of the population. That's pretty extraordinary. But talk about what conscientious capitalism means to you. And in addition to this very large, successful, far-reaching medical business your family runs, you have a family office and you're active with that. So what does this mean, and how do you think of that?
So it's something that I've been personally studying for years. There's a Jewish scholar named Maimonides, and in the 12th century, he talked about tzedakah, which is the Hebrew word for charity. And there was different levels of giving. And the highest level of giving was not giving money, was partnership. How do you help people get out of their poverty, get out of their financial dependency? And it was to form partnerships, to create jobs, and to create opportunities. And that is something that I've been thinking about, and my family has been thinking about for a long time. So let me give you some real life examples. We have some programs going on with Native American Indian tribes. There's 325 Native American casinos in the United States today. There's a high prevalence of mental health issues, of diabetes. So for us, when we think about how do we develop a solution, the solution, there's got to be an intentionality to it. And part of it is to involve the Navajo people and create jobs and opportunities. So we have set up a partnership with the Navajo Indians in New Mexico, putting jobs and opportunities to help service that business. So it's not just giving money. In the prior lecture, they were talking a lot about greenwashing and how a lot of people think if they just give a check to a cause, that is, absolving them of any additional responsibility. So that whole concept of partnership, that whole concept of giving, I think is very important. And it's also important for sustainability, because whatever programs, whatever you do, the only thing that's ever really changed the world is a bunch of thoughtful, committed people coming together. Margaret Mead said that, and it's something I always remembered. So I think it's very important to involve all the key stakeholders, and I think that whole concept of tzedakah and giving with intentionality. Now, the other thing they were talking about in the prior panel, okay, we're giving, but let's get the returns first, and then we'll worry about, everything else, and to me, it goes hand in hand.
Yeah, I think that's at least important from the way that we think of it. It's self-reinforcing. In other words, the more you help people, the greater the returns. The greater the returns, the more you can help people. But it's self-reinforcing.
Exactly.
So you had the opportunity to speak at the Milken Conference, which you should tell people. Well, I'll tell people. So the Milken Conference has now been going for 25 years or something like that, but led by Michael Milken. It's a global event. It's capped out at about 4,000 people, but I think Mike says there's 1 billion people that see it streaming. Knowing Mike, you can divide that by 10, it's 100 million, but still it's a lot of people. But it really is, it's the people that make the world go round, and Stephen had the opportunity to speak there a couple weeks ago. So you talked about modernizing the global supply chain. How does the conscious capitalism play into that? And tell people what you spoke about and what your experience is there, what you learned there. I think that'd be interesting.
So one thing we learned during the pandemic, the global supply chain is like an 8-track tape, and we needed to make it an iPhone. It was pathetically and woefully out of date and inadequate. So I spoke specifically about healthcare opportunities. So I'll give you an example. By 2030, $200 billion worth of drugs are coming off patent. $200 billion. Now, I'm Middle Eastern. That's a lot of hummus where I come from, okay? So we need to, as the global supply chain is evolving, we need to think about things, and there's a lot of factors to it. So let me give you a few examples. Number one, right now, the vast majority of pharmaceuticals are made in India and China, okay? And we saw during the pandemic, there was a lot of geopolitical issues. There's a lot of other challenges with that. So clearly we need to diversify. But it's not just bringing it to the United States. That's not the answer. And there's a lot of reasons for it. Number one, they call them APIs, active pharmaceutical ingredients, are not, they're not accessible in the US. They're mainly made in China. And there's a reason why they're made in China, because a lot of them are not environmentally friendly. So we kind of outsource our environmentalism there. There's a lot of other considerations that we have to make about the global supply chain. Climate, whether people want to acknowledge it or not. And by the way, I'm not looking at it from a political lens, but the climate is definitely changing. Okay, now how does that affect the global supply chain? Well, when a country has a day that's over 102 degrees, that 102 degrees is a threshold to change the composition of pharmaceuticals. So when you're delivering the pharmaceuticals or when you're getting active raw materials, it changes the composition of it. So we have to extrapolate how the changes in climate are going to affect our global supply chain, the delivery, the manufacture. There's also changes in population. So I can get into all of that. But we're here in Texas, so I often hear about the border in Texas. People are coming across from Mexico, blah, 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 with the implication they're all from Mexico. Well, here's the dirty little secret. 90% of those people are from Honduras, El Salvador, and Guatemala. That's the reality. Yeah, they're coming through Mexico, but they're not necessarily Mexican. That kind of gets lost in this whole translation. So when I'm looking at conscious capitalism, when I'm looking at the challenges with a global supply chain, I'm saying to myself, okay, well, how do we, start diversifying the global supply chain, but also maybe help with this immigration issue? Well, can we start manufacturing products, medical products in Guatemala, Honduras, and El Salvador? So that's exactly what we're in the process of doing now. So if you create jobs, if you create a better life for people, if you give them opportunity, then maybe they're not going to want to leave everything that they have and know and put themselves and others in harm's way by coming through the border. Okay, so that's one example that we're looking at, and we're actively moving forward. I think we're going to deploy billions and billions of dollars in diversifying the global medical manufacturing and supply chain over the next 10 years. And part of that is where can we create jobs, where can we create opportunities that also can solve problems?
Yeah, it's incredible. So I mentioned that you were at the Milken conference, seeing Mike Milken. I'll call him the Pope of capitalism. And you've also spoken to the actual Pope at the Vatican. So, and the Vatican, if you don't know, is very interested in impact and these type of issues. So what did you speak at the Vatican about, and how do you, and what are the different parties there? As it relates, I guess specifically as it relates to the stuff that you do and how you use technology to create access and scale impact.
So first of all, I'm Catholic. So Catholic Church has a lot of issues. Let me acknowledge that. But nobody houses, clothes, feeds, educates, provides more health care globally than the Catholic Church, hands down. Okay, not even close. So let me just say that. There's an event every 2 years. COVID, of course, impacted it. So there's an event, the Cura Foundation hosts an event, and they have global philanthropists, Nobel Prize laureates, family offices, change makers, the who's who of global healthcare and the business world come to get together. And it's very interesting because a lot of times when you have those high-powered people, there's also a lot of egos and a lot of, but for some reason, there's something special about the Vatican. When you're there, it seems like or feels like everyone's checking their ego at the door, which is refreshing. But we were talking specifically about some programs around global health. So one program that we started was in a partnership with the DFID in Pakistan and the Commonwealth Fund, where we were taking care of over 1 million mothers and children that never had access to health care and providing them prenatal care. And I can't even tell you, many of these folks never had any care. And these were in the most remote, rural, undeveloped areas you can imagine. There was no internet, there was no electricity. Many of them didn't have, clean water, but we used solar panels and we used satellite. And we put our telemedicine solution in these remote rural areas, and we connected them with physicians in Karachi, the big city. We're providing access to millions of mothers and children. And not only did the quality measures go through the roof, okay, not only did many of these folks, have been trying for years and years to have children, they couldn't do it. But we did more to build bridges across the religious, socioeconomic, and political divide than you can imagine. We put care back into healthcare. And I think that's something that gets lost in our bitterly divided world. I see healthcare as what God called us to do. It's our meaning, it's our purpose, it's our opportunity to build bridges. And I can't even tell you that program, they were spending $1 billion on it for $2 million. They were taking care of 10,000 patients because they were building infrastructure. They were trying to build hospitals and clinics and all these different things. But the problem is they don't have the providers. You can build whatever you want if you don't have the providers there, but by using technology, by using innovation, we were able to provide care. We measure, manage, and optimize the whole process, and we proved it out. So for a fraction of the cost, we moved a needle. And quite frankly, I think there's opportunities like that. I wanted to share something just about global health and innovation. So I was with many of the top people from the Gates Foundation a couple years ago, and they threw me a kind of a question. They said, well, who do you think has the #1 telecom system in the world? And I'm like, I don't know, United States? They're like, Kenya. I'm like, Kenya? Are you joking? But Kenya didn't have a real phone system for years and years, but when they finally invested in it, they didn't have to replace a legacy system. So they got the latest and greatest, and now people can do all their banking in Kenya on their phones. So, they literally don't have to go to a bank. It's the most advanced banking system in the world. And I think as far as global health, there's tremendous opportunities, particularly in these emerging markets, because you can implement these innovative solutions and you don't have to displace legacy systems. So I never thought about it like that, but I looked at what we did in Pakistan with just a small amount of money, but open heart and big dreams, and we did a lot to move the needle, and that was something we shared with at the Vatican, and COVID hit, but I hope we can get back to some of those programs.
So the JB formula, the JB medical, I'll stress, the JB is about combining purpose and possibilities, just like you described, and creating quality access in healthcare. And it was a remarkable story you shared in that perspective. Because of your footprint and the different things you've been doing in the long history, maybe share a couple other stories of how that formula of purpose and possibilities combined with quality healthcare access has played out.
So you have to put this in context. My family never had any money. We never had any investors. So money was never going to be the answer, but we had to find a way. My father always used to say, you figure it out. So we had an opportunity with this group in Southern California called National University, and we were looking at how do we increase access to care. So a couple statistics. A third of the folks in this country do not have a primary care physician. Of the people that do have a primary care physician, 40% don't see the primary care physician in 12 months. 17% of the population doesn't see any healthcare professional over 12 months, but they go see their church, their synagogue, their mosque, their community center. So in a partnership with National University in Watts, a very urban center in Los Angeles, we put our telemedicine solution, which is one of our companies, we put our telemedicine solution, and it was serviced by National University nurses. And so when someone went to their church, their synagogue, their mosque, their community center, they could get some basic primary care. So we were able to move quality measures by 71%. There was more buy-in to their community center. And again, by bringing people together, different constituencies, the community-based organizations, the patients, the families, the providers, we didn't spend a lot of money. It was like de minimis, you wouldn't even believe it. But I think because we've always had to bootstrap everything we did, I think it really has given us like, hey, we're just going to figure it out somehow, some way. And I think the opportunities now are going to be greater than ever. Over 7 billion people are connected via global Wi-Fi. More people in this world have a mobile phone than clean water, which is sad, but a fact. So I think there's going to be more and more opportunities to provide access to care. And so we tried to be very creative, and that's one of many, many stories that we're very proud of.
You should be. So you've said, and it's been described of J&B, that you guys are all steak and no sizzle. What do you mean by that?
Well, we come from a very, very humble background. And so my father, it's a very Midwest thing. We said, all steak, no sizzle. And he always meant, look, if anyone called J&B from the beginning to today, they could talk to a Shaya family member. Now, my brother, sister, and I may beg to differ because it seems like I'm fielding all the calls, but that could be, they may beg to differ a little bit. But nobody was in an ivory tower. Nobody was hiding. We were always available. And I think that's very important. And, we never thought of ourselves as, we're some hotshot anything. We're stewards of the blessings. J&B Medical is a platform of purpose and possibilities. And we're simply the stewards of that. And I think that's what that was all my father, and I think we've always looked at it like that, and it's definitely something that's carried through today.
So you made a statement that there's a lot of legends in the cemetery, but not a lot of legacies. And Jason, I don't know if you heard the investor panel this morning, but Jason Elias made a similar point. What do you mean by that? And what are you doing to change that?
So my father died in November of 2020 suddenly. He was 77 years young. And, he didn't take any money with him, but he left on us, great love. And my dad had an incredible sense of clarity, and a sense of meaning and purpose. And, every day he came in, and our mission, first and foremost, was make healthcare as affordable and accessible to as many people as we could. And today, we've saved hundreds and hundreds and hundreds of millions of dollars. More importantly, we've improved clinical outcomes, we've improved quality measures, and I think we've made a difference at every step. And that really was my father's legacy. He's like, wherever you go, make it better. Wherever you go, make it better. And, a lot of times, especially in this crazy world, there's a lot of, crazy situations. And, my dad is like, look, don't get involved in, taking sides, just do the right thing. And if you do the right thing, things will work out. And he always used to say, there's the hunter and the farmer. The hunter's in it for the kill. They're in it for the deal. They're in it for the transaction. They're in it for something for today. That is not the Shaya family, and that's not Jane B. We're the farmer. We plant seeds of purpose. We plant seeds of doing the right thing. And at some point, with God's grace, those will harvest. And that was my father's legacy. It carries through today. And everything we do, is with that in mind.
I wish you were just a little less passionate, but a little more passionate, I meant. A little more passionate. That's all. Great. So talk about, read a bunch about different programs that you guys run. One kind of grabbed me, the Bobby Dodd program in Atlanta. Talk about that and how that aligns with some of the other things you've been talking about in terms of purpose and possibilities.
So we've been around since 1996. So I'd say maybe the first half of our journey, we would be giving money to various causes, right? We always used to take a certain percentage off our balance sheet, and we used to give money to causes. Not because it was ESG or not because it was counted towards some bucket, but because it was the right thing to do. So one of the causes that was really important to us was veterans. And early on, we'd give money to veterans causes, and finally we figured out, hey, why don't we give them jobs and opportunities? So Bobby Dodd Institute, we have 103 service-disabled veterans with disabilities that work for us today in Atlanta, Georgia. So, thank you. So some statistics, 38% of the people that leave military service are unemployed today. 38%. Now, it might be counterintuitive. You have these folks that are, go in the military, they're working nonstop. How could that be? I believe part of it is many of these young folks are used to a lot of structure. Someone tells them when to eat, where to go, what to do. And so when they leave that structured environment, they struggle. That's my personal belief. And I know there's many other factors, but that's my personal belief. But one thing that we've seen, and if you want to make lasting, sustainable change, is something called total health. The health of the patient, the health of the employee, and the health of the community. So we've made a very important strategic decision. You can call it conscious capitalism. You can call it corporate sustainability and responsibility. Don't call it ESG, because ESG, for some reason, is a political term now. I don't know why, but anyway, I don't really care, to be honest with you. But, investing in the communities, the health of the community was just as important as the health of the patient and the health of the employees. And so we have a lot more opportunities to do things like that. A big focus for us, 80% of the population we service today are underserved, minorities, and elderly. And so that's a huge percentage of the population we service. And so the more that we can impact the community, the more we can make sustainable changes, long-term changes.
Yeah. Well, and by the way, so when we came up with this panel, obviously healthcare is a big, important area. And when I talked to Stephen, and Harry Hawks was kind enough to introduce us, I said, you know what? We're not getting anybody else. We're just going to talk with him, because what he's doing is so amazing and so perfect. I just want to spend all the time we can hearing from you.
Thank you.
Talk about, so you're on Endeavor's board in Detroit. And so for those that don't know Endeavor, it's an organization that helps entrepreneurs thrive, right? Talk about the work you're doing there and what you're seeing both in the healthcare area, but also around this mission movement and conscious capitalism.
So for those of you that are not aware of Endeavor, it started about 25 plus years ago. Two students from Harvard were driving in Argentina, and they were driving in a taxi cab, and I guess this guy was a PhD student driving a taxi, and they're like, and he had all these great ideas, and they're like, we've got to come up with a way to empower and enable folks. So they developed a model where they invest and they call these high-performing entrepreneurs. And the entrepreneurs that show promise, they mentor them. That was the early stages, and they kind of curate it. And then the next iteration now is they have a fund called Catalyst, where they actually can invest in these entrepreneurs. So let me give you a couple statistics. 25 plus years. The companies today, do over $20 billion in annual revenue, have created over 4 million jobs. They have 2,700 entrepreneurs that they've invested in over 25 years. And they're in 42 different marketplaces today around the globe. Now, the thing that's most exciting for me is that many of these companies that have been successful, the unicorns, every time there's one unicorn in a region, these folks are investing back into the ecosystem where they came from. So there's 700 new companies. Every time there's one unicorn, there's 700 new companies and entrepreneurs that are benefiting from that. So they call that the multiplier effect. So they're literally changing the ecosystem in places around the world. So it's a super exciting thing. Of course, I get a chance to see or help discuss many of the healthcare opportunities, and also there's many folks in the family office world. My family office is called Akkad Holdings because we're Iraqi Christians, and the Akkadian Empire was the first empire in Mesopotamia. And so they're great connectors of their time. So the mantra of my personal family office is people, purpose, pay it forward. And so it's a very similar thought process with Endeavor. And it's an incredible group. And it's something I really passionately enjoy. And seeing these entrepreneurs build, create jobs, create opportunities, change ecosystems in places around the world.
So, and you talk about your family office, and you obviously wearing multiple hats, and I'm sure you have a lot of time to relax. Talk about an investment that you've made recently. And by the way, after I ask this question, I'm going to open up to questions for you. So get your questions ready. But think about an investment that you've made recently that you're excited about, and why.
Well, there's a few, so forgive me, I'll go through a couple. So first and foremost, mental health is really just disappointing in this country. Personally, I had a relative commit suicide 2 years ago, 37 years young, 3 young children. Every time I see his children, I look and I'm like, gosh, the system failed at every step. So there's a mental health platform that we're investing in, and ultimately we're going to acquire, and it's kind of an end-to-end. You can do the surveys, but they also have the therapist, and then we're going to be training therapists because unfortunately, one of the things that when you started looking at the quality of the clinical outcomes, there was issues. So how do we have a platform that we can end-to-end diagnose, treat, and continuously monitor. And I have young kids, 10, 8, and 6. Every time I hear of a school shooting, everyone talks about guns. Okay, that's one issue. What about the mental health issues that are not being addressed in this country? That's you don't hear people talk about that. And that is really part and parcel. If we're going to get at the root problem, the guns, that's a whole nother issue, okay? But the mental health, the underlying mental health, we have to have a way. And by the way, one of my friends is a sheriff in Oakland County in Michigan. He used to be the head of the Oakland County, the National Sheriff's Association. He's saying 70% of people in the police and fire department, have underlying mental health issues. The stresses that they're getting day in and day out. Attempted suicides. Mental health, 22.8% of the people in this country have mental health issues. Almost 58 million people have mental health issues, and we are just woefully not taking care of it. So that's one. Number two is social determinants of health. 80 to 90% of health is due to non-medical factors. Okay, so let me give you a real-life example. Okay, we're going to ship insulin to these patients, their diabetic supplies. We're going to ship them, their test strips, their continuous glucose monitor. But what happens if they don't have a refrigerator for their insulin? Okay, what happens if you get them everything, their drugs, their supplies, but they're not eating properly, so they have food insufficiencies. There's so much social factors. Up to 80 to 90% of the social factors are affecting healthcare. So we've developed our own platform. We call it for healthy opportunities or social determinants of health, and we're rolling that out. And then the third area that I think is going to be big, one of the silver linings of the pandemic is more and more people are asking for healthcare on demand. So during COVID, a lot of people were testing themselves at home. and they were chaperoned in many cases. Well, I think there's tremendous opportunity there to do testing in the homes. A lot of these mobile labs struggled. They were trying to do venous blood. They had these, kind of clunky cars that were going to try to collect the lab stuff. I think the future is going to be taking capillary blood and being able to test your hemoglobin A1C, your LDL, being able to do all these lab tests in the homes. And there's some companies out there that are doing some iterations of it, but I think that's the next iteration of healthcare on demand. So,
Questions for Dr. Shaya?
Well, first of all, thank you for the question. Clearly, health literacy plays a big role in overall health. So the more people are educated about their health conditions, the better outcomes they have. There's a lot of medical data that shows that. So I 100% agree with you. I think I have some ideas for that, but let me just talk about one. So in this country, we have $125 billion goes into health savings accounts. And then I don't know the exact number with the flexible spending accounts, but what I do know with the flexible spending accounts is $4.2 billion last year was not spent. And what's not spent, it just expires. So there are monies with companies that they have that I think could be repurposed for some of what you're talking about. And so that's something I'd love to talk to you more about. But there are a lot of resources out there that are not used. And so short answer to a much longer discussion is I think we need to repurpose funds and put more resources into health literacy, health education, because ultimately that's where we're going to get the biggest bang for our buck.
So besides Cliff being on the board of Dallas College, you were the chairman of the big hospital, Parkland. No. Thank you.
So one of the silver linings during COVID is you could be licensed in any state and provide care to folks in other states. Now that ended, but I think this multi-state licensure really needs to be revisited. So the VA hospital, if you are in any VA hospital, you can provide care virtually to anyone at any other hospital. Okay, so I really think it's time for us to open that up. Clearly, the technology now is improved. A lot of these, there was a lot of concerns with patient health information early on, but even Zoom and some of these folks now have got their special encryption to do medical consultations. That was kind of, some of the issues as well. But quite frankly, the incentives have not aligned with the innovations. And I don't buy it anymore. After we made a vaccine in 9 months that normally takes 7 to 9 years, and why? Because they cut all the regulatory red tape, so if we can make a vaccine in less than 9 months, a lot of these old antiquated thinking needs to be revisited. And U.S. healthcare today is the 4th largest economy in the world. And it's going to be the 3rd largest by 2025. Put that perspective. Economy, okay? I mean, think about it. U.S., China, Japan, U.S. healthcare, okay? It's staggering. We can't afford it anymore. And a lot of these old silos, these old barriers, we really need to revisit them. I want to leave you guys with one thought in regards to that also. People talk about all these great things. I'm sure you're going to hear about many great ideas over the next few days. But you know what innovation is in healthcare? It's integration. How you can weave it into the delivery of care. The people that know how to do that, anyone could have a gifted gadget, gifted gizmo, mobile app, sensor, shiny object. Every day I get like 5 of them coming my way. But how do you weave it into the delivery of care? That is the question. And the people that can answer that question, they're the ones that are going to do extremely well. And the ones that can't answer that question, they're going to flame out. You have like the American Telemedicine Association. We've had numerous conversations with numerous, key constituencies. I think, there's certain, I don't want to call out people, but there's certain groups that have just, been very slow, to jump on board, mainly providers. A lot of providers are afraid that they're going to lose, their patients and I think now that the next generation is thinking a little bit differently. They want a more flexible work schedule, so they don't want to have to go to work. They could work from home, so I think that's part of it. But we can talk about this all day. I'll talk to you offline about that.
Does your company have a funnel for if you've made a patent and you know it works and it's medically based, is there a spot to just go here or drop it off?
So for us, we are the quintessential folks when the cake is baked and to deliver the cake. So if you just have the intellectual property, we have a whole ecosystem of family offices and other folks that will. So if you have a great idea and intellectual property, but you need to commercialize it, we would connect you with folks, within our ecosystem. We have about 2,000 family offices that we interact with globally about a variety of different issues. So if you have something, I'll give you my information. Just email me anything that's non-confidential, and I'll get you in touch with a few folks. But a lot of people in our ecosystem, they love the napkin, a great idea on a napkin or a patent, or I have several groups that are going to universities and academia and trying to get professors that have great ideas, and commercialize them. So, but that's a little earlier in the ecosystem. Where our company thrives is once it's something's like ready to be distributed globally, then that's when we can get involved.
You spoke very passionately about your mom and your sister and the legacy of your dad. Bearing in mind the challenges for women's health here in Texas, have you considered, or maybe it's a forethought around women's health and how to support that even from a technology?
Oh, it's a great question. Thank you. So first of all, let me just say globally, the best investment you can make is in women and children. There's unequivocal data that shows there's a force multiplier effect in any community, any society, anywhere. When you invest in women and children, that's where you get the best bang for the buck. Forget the men. The men are useless. Oh, sorry, I can say that. I'm a man, I could say that. So it's as far as something specifically around women's health, we've focused on a couple different areas. So because we work with a lot of insurance companies, a big part of our focus has been around prenatal and postnatal care. So I'll give you just one example, just a simple example. So women that go to their prenatal visits in certain places that are our customers, they will get certain things. For example, if they attend all the prenatal visits, they'll get diapers, they'll get all the, car seats, encouraging them to go to the prenatal and postnatal visits. It's just a simple thing. It's not sexy, but believe it or not, it moved quality measures by 37% in 3 different populations. So I think there are a lot of practical things that you could do short term, but there are much longer term opportunities as well. So just like with anything, you can't have, there's no one answer. I think you have to have a short term, a midterm, and a long term view. Short term, we've been very practical. What is something that can make their lives easier, give them a little incentive, and so anyway, I think there's a lot of opportunities. I definitely, would love to talk to you more about that.
We just have a couple minutes left. Anybody, please?
I was curious if you could share a little bit more about how you've effectively partnered with corporations, big corporations.
Partnered in, you mean like in what sense? Like, like how we've partnered with like manufacturers or what, like what do you?
So maybe, yeah, I guess with all types of companies who are in the different parts of the healthcare.
So let me start with the manufacturers, okay? So with the manufacturers, we deal with over 1,000 manufacturers today, medical manufacturers, Medtronic, Johnson & Johnson, Abbott. We sell over 1 million products. The way we've partnered with them is we're a testing site for many of the new products. So we love testing out new products. When the new Abbott continuous glucose monitor came out, we were one of the first providers in the United States that had it, so we could provide real-time feedback. So in Proverbs in the Bible, it says iron sharpens iron. So as a partner, we were providing real-time feedback and where we thought it was good, where they could improve their educational materials, et cetera. So that's one example, but I think the spirit, we're not transactional, the spirit of partnership where we're constantly providing feedback on products, on what's working, what's not working, I think that's important. On the payer side, we have tried to solve problems for the payers. So we started off in an area, home medical supplies, that was wrought with inefficiencies. To give you an idea, in 2011 to 2021, in 10 years, 65% of the home health, DME, whatever, people to the home are no longer in business because there's a lot of mom and pops, kind of fragmented kind of group. So we were one of the first that came with a streamlined supply chain kind of solution, with the payers. One program in the state of Michigan, we saved them $212 million, hard dollar savings, their numbers, and improved clinical outcomes, improved quality. So with our customers, we're constantly trying to find ways to improve. Now, one of the challenges with that is you're only as good as your last thing, right? So every few years, they're like, well, what else are you going to do for me? Well, you remember that $200 million we saved you over 10 years? Oh, that was great, but what are you going to do over the next 10 years? So I think the moral of the story is if, you got to constantly, it's got to be dynamic. Healthcare is changing rapidly. And when you have a partnership, you have a high level of communication, collaboration, and so we're not folks that just move a product from point A to point B. It's really trying to provide, solutions and really, problem solvers. That's really our business model. We've been very opportunistic at it.
So you got we're out of time, unfortunately. So we got one last comment. If you have a parting shot of wisdom.
Parting shot of wisdom. Well, I will just say to everyone in the room, my dad always used to say this, chase your passion and you find your purpose. And then I think when you find what you're meant to do, it's not work, it's something that you're energized and excited. The other thing I wanted to share is from my grandmother, a quote from Mother Teresa, and just to say, not all can do great things, but we can all do small things with great love. So I know a lot of these challenges seem very daunting, and can be frustrating, but we all can do something. Let's all do our part. That's the only way we can, make a difference, and we're all in this together. So sending many blessings and love to you and your families, and thank you, Michael, for this opportunity. Oh, thank you.
Yeah.
Oh, thank you. Yeah, I want to talk to you about this health literacy. There's got to be a way to do something,
Well, not only just the literacy, but